About 90% of health IT companies have now agreed to develop standards to make electronic healthcare records more accessible. Susan DeVore is CEO of Premier, a healthcare improvement company who joins me. So nice to have you here.
Thank you.
And we basically saw action out of DC yesterday. So let's backtrack and explain, I guess in layman's terms, what happens and how it's going to change the industry.
So this is a great first step forward. Basically, the Secretary of Health and Human Services got a pledge, a commitment from the electronic health record companies, other associations, some big healthcare systems, Premier included, to say, you know, we are committed to making healthcare systems talk to one another and having standards to make that easier. So this is a first step. We don't think it's enough yet, but it's a first step.
You're in this business already about
Right.
trying to make things easier. You have this platform called Premier Connect, which basically connects all the people that have to be there for somebody's health care. What will it mean for your business? Does it mean you get increased business? Does it change the way you operate?
So the way healthcare IT works today, every time you need to connect pieces of data to really help deliver patient care better, you have to build an interface, and you have to pay for that, and you have to take the time for that. And we think it costs our healthcare systems $50 million a year, each system. 25% of our systems say they cannot connect data without a manual intervention. This starts to put data in standard places with a standard way of being able to access it. Think about your iPhone. You can put any app you want on your iPhone. You can't do that in healthcare because it can't be connected to you that way. And so that's what we're trying to fix.
So a couple of questions off of that. People are always worried about privacy issues with these electronic records. And it doesn't matter how much you try to convince them. It just seems that this is always top of mind. Are there any safety concerns, or are there fewer safety concerns if there is a broader interconnection?
You know, I think privacy and security is the highest priority for Premier. It's also a very high priority for all people in this space. And I think you have to make sure you are safeguarding and protecting the privacy of patient information. But patients want their information to be connected. So you have to find a way for them to be able to access their data and connect it. And then if we really want to cure illness and we really want to take care of patients with chronic conditions more effectively, we've got to have data across providers and across patient populations. So I think it can be safeguarded, and I think it has to be a high priority.
Will this help lower medical costs? Because that's another top of mind issue always. Or will it be more expensive in the short term?
I think it will absolutely help in the long term lower total cost of care, because I think it will help you identify overuse, misuse, underuse, and it will give providers the data they need to take care of patients across the continuum of care more effectively, and I think that will reduce costs.
In terms of your own business, where are your growth opportunities right now?
So we are a double-digit grower on the top line and the bottom line. We have the data platform and infrastructure. We have lots of applications, data, and we have a big group purchasing organization. And everything we do is all around how do you lower the cost of healthcare? How do you make it safer? How do you make it higher quality? And so all of this change and all of this interconnectivity journey is good for our business.
It's also it stemmed from the Affordable Care Act. And we know in the political season this is something that comes up, and we still hear talk about repealing Obamacare. Do you think that will actually happen, that there will be maybe not a repeal, but a rethinking of what happened in the Affordable Care Act? Do you have any sense about that?
I don't think it will be repealed. We are 6 years into the implementation. We now have 17 million people who have access to coverage that didn't have it before. We have 20 plus states that have expanded Medicaid. Really hard to take that away at this point. I think it's all going to be modified and enhanced and improved in the regulatory implementation. It might be called something else, but at the end of the day, the problems are still the same: cost, quality, safety, and how do we take care of populations? So I don't really think it's going to be undone. I think it's just going to be modified going forward.
Susan DeVore, CEO of Premier, thanks so much.
Thank you.
I'm Rhonda Schaffler for TheStreet.